This is a big progression. The stack, part 14, for better core and breathing, we are going to take the floor away. So in part 13, we had you on the ground so that you could build that kinesthetic awareness. In other words, that ability, that skill to know where your bones are in space, but we gave you the ground so you could stack your ribcage and your pelvis properly. The ground also helped you feel that intra-abdominal pressure, feel that back body expansion. All of that goes away. So here are some of my favorite prone-based positions so that eventually you can take that stack vertical. One thing we have to talk about before you even think about setting up your core is your hand. Your hand is going to be on the ground, and distal support affects proximal stability, just like a foot. So this is what I want you to think about. Always have long, wide fingers. Always have pressure through the tips of all 5 digits. Always have equal pressure through the thumb side and the pinky side. You're going to want to do this. I also suggest trying to pressurize that second MCP. Now that those are active, you can load your wrist. Also good to think cubital fossa is in line with the thumb. Shoulders, always try to think about them wide. And now you're ready to set up your stack. So step 1, let's just play with quadruped. So remember, in our supine setup, we wanted that T8 retraction. We wanted that L3 punctum fixum pressuring the ground. And we want a flat spine. The goal was that you then develop that kinesthetic awareness to find it when we take the floor away. So if you need to, you can use mirrors and things like that, but you need to be able to organize your bones in your head in space without using your eyes. This is our goal. From here, it's kind of nice to flatten the feet out, pressure the shins. That will give you a little bit more of an abdominal wall, and you should be able to feel that expansion in the back body when you breathe in, pressurizing 360 degrees around your abdomen. Because I don't have my hands to check my intra-abdominal pressure, I often do use the Core 360 belt, just the $50 one, not the $300 one, and it is very useful for biofeedback about, am I getting pressure in that kidney area all the way around? So in this position, you could try rocking back. Can you dissociate hip motion from back motion? This is like a squat. We need this dissociation. Option to band it if you want. Breathe in as you go back and open those hip muscles. Breathe out as you come up. From here, you can tuck your toes and come up into low bear. Make sure the knees don't come in, everything stays strong, and breathe. From there, you can work on that hip dissociation. Can you keep your core unbreakable as you push back into high bear? Option again to band it. This is to help give you that feeling of elongation of your spine. Keep checking on your hand position. Keep checking on your breathing. Another nice option is to sit into a physio ball. Tuck your toes and then hunt for that elongation. So good also for opening pelvic outlet, pelvic floor, posterior hip. Option to come up into bear plank taps. This is much harder, fabulous for serratus anterior activity. This is about overhead movement, but do not let your back twist. Don't let it side bend. Don't let it arch. It stays unbreakable. Slightly easier position is going into a 6th month prone. So pressure is a little bit on the inside of the knees. We have a strong spine, strong arms. In this position, you can just breathe, or you can try a shoulder tap, making sure you don't lose stability. When you pick up one hand, these zones of support switch to the opposite hand and leg. Drive those into the ground to find those oblique chains. This is also a lovely position to differentiate. Going from undifferentiated to differentiated. You can pick up That other hand, again, zones of support and oblique chains. Press into the ground. You can also go to a wall, try dragging your feet up the wall to bring in your hamstrings, and do your 6-month prone in that position. The hardest option are bear plank options. So this is a hybrid between bear and plank. You have the option of going to the wall, trying to drive the heels into the wall, and we are almost up in plank, except there is a small bend in our knee, which helps us get that stack a little more easily. If you're feeling confident here, the option is to add a march, keep the heel driving into the wall, no spine movement, just marching. The other option are shoulder taps, trying not to move your spine, try to stay unbreakable. All right, those should keep you busy for a while. Remember, we need to come back to our 3 tests. Are you integrating diaphragm into your core? Which means you're creating intra-abdominal pressure all the way around. Are you getting rib cage expansion, which means that diaphragm is nicely positioned? You're integrating diaphragm into breathing and core. Number 3, trying to keep your head and neck out of it. 4th thing you have to think about with these is what you were doing with your hand and making sure that is a quality support, because if this isn't quality, then it affects the stability proximally, so shoulder and rib cage. All right, get good at that, because next up, step 15, we get to go into transverse plane motion, rotation, because many of us are sagittalized and can't get out of this. And some of us are stuck in the frontal plane and can't get out of this. And motion is just more fun if you can rotate.